Warm welcome to you from Geneva, Switzerland. I'm Rida Sadki from the Geneva Learning Foundation. This is Insights Live, our live stream in which we share what we are learning from people who do global health. Hence, we're delighted to welcome back Kate O'Brien, who last spoke to us in January 2021 at the first annual Teach to Reach conference with over 7,000 national and subnational immunization staff in attendance. That was over a year ago, just when the world had begun to distribute COVID-19 vaccine. Charlotte Mbu is our Insights editor. I'm actually filling in today for Ian Steed, our other Insights editor, as he's currently on sick leave due to COVID. Charlotte, how are you doing?
I'm doing great, Reda, and hi to everyone. It's a pleasure for me to be here today.
And Dr. Kate O'Brien, you're the Director of Immunization at WHO headquarters. How are you doing today?
Having this conversation.
All right, wonderful. So the Geneva Learning Foundation has nurtured what has now become the world's largest digital health platform, reaching subnational immunization staff. As of this morning, 40,848 people who deliver vaccines are connecting through our platform to learn from each other, support each other. Now, Kate, you told us in January 2021 the lessons and learnings are coming from people who are working in the community, you said. That is where vaccination actually happens. We need to be focusing on the most local level of the immunization program. Charlotte has our first question for you.
Thank you, Reda. My first question for you, Kate, is, can you tell us about a time when you learned something or changed how you were working based on an insight from frontline practice?
Oh, that's such a great question. And the thing that comes to mind immediately is, as somebody who comes from a science background, a medicine background, as opposed to necessarily a behavioral health background, one of the things that I learned that really sort of changed how I think about vaccines and what it takes to really support community demand is that I think we anchor too much on the science and the evidence. It's such a natural thing for us to do that people would sort of respond to evidence. But I think what I've learned is it's actually much more about motivation of people to actually get vaccinated. It's much more about their intrinsic sort of desire to be vaccinated, and really supporting that motivation is so important above and beyond just giving more facts about what vaccines do, what they're about, what they're performing against. So that's something that I think really comes through from the community level work, that we have to work much more on this, what people, sort of hearts and minds, if I can put it that way, what people think is important, as opposed to just giving more facts and figures.
In the last 48 hours, we've received over 200 testimonials on a range of issues from people across the network around motivation, around the challenges being faced, and around what kind of support would help. Charlotte has selected two from Uganda and Ukraine. Charlotte?
Yeah, from a woman in Uganda, she says, my challenge is the lack of skills of our health workers to make use of data. I want to improve the use of data by building capacity of health workers in data use and analytics. I need collaborative guidance and support. And then from Ukraine, she says, I want to get those not fully vaccinated against polio and other antigens, especially those not registered in the system. We are assessing the situation and exploring ways to do so.
So, Kate, the point is not to ask you to provide them with solutions, not even to provide them with the latest guidelines from WHO, but rather to ask you, what do you think we can or should be learning from such experiences, from people sharing their challenges, stating their intent, reporting on how they're doing, how they're making progress? What do you hear when you hear these two quotes?
I think first of all, I think those two quotes are amazing because when we sort of envisioned this next decade, there were really a number of absolutely top line, highest priority issues. And for me, it's incredible to hear these reflected back from people who are working on the front line. The first is that it's really hard to improve a program when you don't have any navigation tools. In other words, data. So to hear back that people are at the front line are seeing the value of data in their day-to-day work, in their day-to-day skills, that they want to know how to use data that would actually shift what they do on a day-to-day basis, that would help direct their effort today into something that would be as impactful as possible. So that's incredible to see that the idea around the importance of data, which for me is at every single level of the program to vaccinate people, probably most importantly at the level of the parent, the care provider, who actually holds data in their own hands, which is that immunization card. That is a piece of data that families, can use as a means to understand and get motivated, as we just talked about, to assure that they're up to date on vaccinations. And then the second one is really about people who are, kids who are most left out. So to hear also, about the motivation to find those who are most left out. I've always said that it's not a mystery to the communities that are left out, that they are left out. It's not a mystery to the people who are working at the most community, most subnational level. They know, you guys know where those kids are. You know what those communities are because you live in those communities, or you live near them, or you live next to them. And so all we have to do is just ask the question, where are those communities, and what's the best way to actually offer services and have those services taken up? So just hearing those two things, data and then what we call zero-dose kids, reflected in those comments is really exciting for me to hear that coming from the most grassroots level.
Wonderful, thank you. We always mark a pause to say hello, to greet some of the folks who are following us, because this live stream is being streamed across Facebook, Twitter, LinkedIn. There's a few others, but right now I just want to convey a greeting back to Ashley Royale, who says greetings from Ghana. So this is actually Bernice. We don't know if let us know where in Ghana. We have many. There's a very strong scholar community in Ghana, but good to see you. Good to have you with us. Abdirazak Turbak Mohammed from Somalia is also connecting. He's connecting via Facebook. And then we have Ahmed Malin from Somalia. We don't have time to greet everyone, but also beyond the greetings, if you have a question, if you have something you'd like to share with Dr. Kate O'Brien, she's the Director of Immunization at the World Health Organization, and she is here to share as well as to listen. Now back to you, Charlotte, with your next question.
Thank you so much, Reda. So my second question for you, Kate, is why is it important for you in your role that global immunization partners respond to the experiences and insights of people working at the front line of global health?
Wow, that is an easy question to answer. Frankly, nothing we do is relevant if it's not relevant for people who are working at the front line. And just like, I'm a pediatrician, and when I first became a pediatrician, I learned a painful lesson, which was the mother of a child always knows more than I know because there's intuition, and because she's with that child day in, day out, hour in, hour out, 24/7. And I think that's the same approach that I bring to, the global role on immunization, which is our job is actually to bring together everything that is known by people at the grassroots level. That's where the action is, and our guidance that is basically one means to share knowledge and expertise that's coming from the grassroots level around the world, and to share that out with others who may not have had that experience yet. So for me, it's like what our job is. Our job is to take everything that you all know at the grassroots level and bring it together into sort of that collated guidance.
Kate, we have another testimonial selected from over 200 received just in the last 48 hours as we're getting ready to launch what we're calling our contribution to the movement for immunization agenda 2030. Charlotte?
Son, she says, my challenge, missed first doses of vaccines among those born in private hospitals. We have done faction mapping and are trying to overcome this challenge through advocacy. My success story is that my team and I have been able to mobilize many families to visit government centers for vaccination. And the next one also is from a woman in a health facility in Pakistan. She says, for zero-dose children, I have a strategy. During polio campaigns, we visited each and every door. During that visit, we enlisted each and every child. My challenge is to cover 100% zero-dose children in mobile populations. I want to establish a special team to always serve this community. I want to get good strategies and ideas from all over the world.
Charlotte,
thank you.
We're going to add one more voice, and this is Elizabeth Akbekfe, who's asked to speak in this, and I hope her connection will be with her. We're going to try to bring her on. Elizabeth, please do introduce yourself, and you have a question for Dr. Kate O'Brien, but first tell us who you are and what you do.
Okay, good afternoon. Can you hear me?
Loud and clear.
Yes.
Okay, nice to meet you, Dr. Charlotte Rada, Dr. Kate, Rita and Charlotte. It's a pleasure and an honor to meet you here in the meeting. I am a communication for development professional, managing campaigns for UNICEF and the primary healthcare development agencies in several states in Nigeria. I've done this for the past 10 years plus, and being at the grassroots, working with the healthcare workers at the facility level, we get to see and feel their pain. So when you were saying something about getting enough data to be able to do things better, it occurred to me that it was one of the challenges I brought up in one of our scholar exercises. And that's why I posted that question in the chat box. What do you think we should be doing about reducing the cumbersome nature of data tools at the facility level? I mean, we should be progressing towards something more efficient and cost-effective, climate-friendly, and efficient. Because, for example, you get to a facility and then you have a worker that is attending to patients, attending to so many things, having to fill so many forms. And then when there is a campaign, a mass vaccination campaign, they're encumbered with additional data tools to fill. So, and you know, from our point here, WHO is responsible for producing, churning out those paper forms, A1, A2, A4, A-sized papers. So what do you think we should be doing to reduce this cumbersome reporting, cumbersome data collection, and all of that? Thank you. That's my question.
That's a great question. I'm reflecting on, you know, when I worked in, one of the places I worked was in a hospital in a slum area of the capital city in Haiti. And first of all, I feel your pain. I must have filled out more logbooks and more duplicate information that I found incredibly frustrating because there was so little time to actually spend doing the actual work, as opposed to filling out forms and logbooks. So you're pressing on a sore point for me that I've lived very much and know exactly what you're talking about. I think there are two things that I'd really love to say about that. The first is that we live in 2022 now, and having digital tools that are handheld tools, that are seamless tools that can actually move information that's already been entered once over to another place where it needs to be is, of course, where we need to be. So I think every effort to relieve health workers from this cumbersome logging of handwritten information on paper, which is duplicated and then reported again in another, as you say, A4, depending on what the logbooks are looking like. So for me, it's about digital tools. The second is about what I call free the data. And there's so much information that gets kind of log jammed as it moves from one level or one need for the information as possible. So for me, those are the two really sort of priority areas, is digitalization of our day-to-day work. And the second is not being afraid that data is going to be harmful in some way. In fact, data is usually extremely helpful, even when it's not data that shows the performance that everybody's hoping for, because it points the light on where more resources are needed. So I love that question, and I love. I think really those are the sort of two directions that I would kind of point our collective effort in: digitalization and freeing the data.
Thank you, Kate O'Brien. You're the Director of Immunization at the World Health Organization with us today. As at the Geneva Learning Foundation, we're getting ready to launch what we call the full learning cycle, in which we're inviting national and subnational immunization staff to come together to work through the full continuum, from acquiring knowledge to generating and sharing ideas to action planning to implementation, and doing it together, connected in digital ways. Now, that is, in the coming days, we'll be doing a lot more to communicate around this. But I know that Charlotte Mbu actually has an invitation for you. And this invitation comes from on behalf of a collective of 143 women who deliver vaccines in 38 countries. Charlotte?
Thank you very much, Reda, and thank you so much, Kate, for answering my questions today. So I would like to invite you on behalf, as Reda just said, of a group of 143 women from 38 countries. We are women who deliver vaccines, who came together to celebrate and honor all the other women who are on the front line, who have been ensuring continuation of immunization services despite the COVID-19 pandemic, and are also contributing on a daily basis to COVID-19 vaccination at different levels of the health system. So we'll really be excited if you could join us on the 4th of March. That's the week of the celebration of the International Women's Day, for this special event. We consider to us it's going to be a historic event, because it's the first of its kind to give voice to women who work in the domain of immunization. And we call ourselves women who deliver vaccines. Thank you, Reda, and thank you, Kate.
All right, Kate, would you like to respond to that, to this invitation?
I absolutely love that. I was looking at women who deliver vaccines, and I thought, wow, I get to be honored by being part of, I guess I'm part of that group. So I would love to do that. March 4th, I want to find out more information. I hope anybody on this call who's not already got that on their calendar is going to put it on their calendar also. I'd love to join you for that.
Wonderful. Thank you so much, Kate O'Brien. All right, this is the end of the live stream. And I want to thank Kate for joining us, as well as the founders of the organizing committee for the International Women's Day event, as well as the Teach to Reach organizing committee. A few of you are in the room with us today, and many of you are with us online again. On the 4th of March, today we were here to discuss singular insights by and for the people who make global health. But we are getting ready and running up to the 4th of March, when we'll be having the 5th edition of Teach to Reach, and coming together to discuss, first of all, women who deliver vaccines. We'll be sharing their testimonials, sharing their challenges. Second, we'll have a big focus on motivation. So we'll be listening to testimonials of how people, wherever you work, how you get up in the morning, no matter what the hardship you face, to continue the work of immunization, especially during the pandemic. We'll be hearing again on the 4th of March testimonials around this, as well as continuing our discussion with vaccine hesitancy with Heidi Larson, Africa CDC. But Heidi and Africa CDC will be listening to what you have to say, to your experiences, and then sharing their feedback, their insights grounded in their expertise. That is how we hope to stir a new kind of conversation within global health by and for the people who make it. Thank you very much, Kate, and thanks everyone, and goodbye.